You stay frozen. You stay frozen right now.
Really?
I hear you, but your head stay moving, but your screen is frozen.
Here we go. Calgon, take me away. Calgon, take me away. Oh, I gotta get ready for this here. How you, bro? How's it going, man? Happy Veterans Day. Happy Veterans Day.
Yeah, tonight I decided to put on a green light.
I see. I
Okay.
see.
You know, since
Hey, bro. How's it going, man?
besides being Veterans Day today, it's a beautiful day, but it's also a day that when many traffic lights are missing the green light, it's in the Iona household right now behind me.
I know. I saw that. Last night was red. Tonight is green.
Yeah,
I see and hear both of you. Okay, so we're on. Charlie, we're live. Did you know we're live?
yeah, but you're frozen again. It's just your head is moving there, but
Amen. I love that. Amen. Yeah, first of all, let's mahalo all to the veterans out there.
yeah, you gotta.
Um, we got a bunch of them. I know that. We got a bunch of them. A lot of them are here. Veterans Day. I love Veterans Day because when you go on Facebook and you see all the posts from people that you didn't know was a veteran, and some pictures. I mean, very emotional time for a lot of these people, and we appreciate especially you combat vets out there that had to go in harm's way. I was blessed; I never had to go to a combat zone, but I know a lot of people did, and we thank them and we pray for their families, and of course we cannot forget those that never came home. So anyway,
Yeah. Well, today on the news, they celebrated the life of a gentleman who fought for our country for 42nd. Mr. They call him Susumu Nakagawa from the Big Island. Seaside Inn. The son has taken over. And unfortunately, he succumbed to COVID. He was one of the veterans at the Otsuku, the Yukio, that state veterans home in Hilo.
yeah, yeah,
And the son was just explaining, boy, just, the father has been through so much through the war. And then all of a sudden, this virus just hit him one time. And so I'd like to send out my condolences to the family. Passed away day after his birthday. I think it was his 99th birthday or 98th birthday. So send my
man,
condolences to the family. And he
yeah.
passed away in September. I didn't know that. Yeah, I didn't know that. Rough.
Well, that's terrible. That's terrible. But prayers go out to everybody. So anyway, tonight we got a good show for you guys. We got doctors Kapono Chong-Hanssen and Elizabeth Ignacio. They'll be chatting with us a little bit about COVID
Yeah,
um, and a lot of other things. But again, Charlie, again, man, it's like every day. Today, it's a holiday today, but the numbers come out again. Kauai had another case, another travel-related case, another case where someone came back from the mainland and took the test negative. Got informed that she may have been exposed to COVID on the mainland. Took a second test positive. So we are, and then you read the paper, and we'll have Kapono. I saw Kapono. He did post about it, so we're gonna ask Kapono, Dr. Chong-Hanssen, about it. But you read the report from the state, and we've had what 15,000 tests taken, only 9 positives. Well, if you do the math, that kind of means that the vast majority of only on Kauai,
but what is nine?
nine,
I thought it was 12.
nine. I think his article said. I whatever it was, even if it's 12. No, it was 15. It was 15. Oh, you mean the
Out of the 18, yeah,
yeah.
out of the 18, 12 is attributed to Kauai.
Oh, yeah, right. Yeah. So
Okay, but
six.
yeah, but here's the thing that I'm getting after. They put down they said that the 18 out of 15,000, right?
Right.
Right. Okay. But if you take 12 of the infection rate and you attribute it to Kauai alone, and that equates to how many numbers? Say 3,000 out of the 15,000 just for Kauai. It's not 1 in 1,000. It's like 1 in 250. That's
Mhm.
the point I was trying to make.
Yeah. No, no, your point came across pretty strong. That's the problem, though. They're trying to make the numbers match the lieutenant governor's prediction, the 1 in 1,000.
You dilute the number. It's
Yeah,
very
it's real
easy to
simple.
do. Yeah, you just dilute the number. Yeah.
In in the white collar investigative world, it's called cooking the books. You got to cook the books. So when you go before your board of directors, in this case, before your constituents, you got to make sure you're doing what you said you was going to do. You promised us 1 in 1,000. We know it's not 1 in 1,000. We know. I mean, just look at Kauai. Tomorrow I'll try to get the exact numbers of the actual arrivals. We know that only 2% of the visitors are taking the second test. That may have gone up since, because we did have more widespread testing, but 20% of the residents, returning residents. Bottom line is this: there's a lot of people not being tested the second time, and many of the ones that have are coming back positive. So that's scary. That is very scary. And
Uh,
we continue to market our state. We continue to open up our doors, and just got a call from my friend, or a text from my friend about an hour ago, 45 minutes ago, that he just got called back in to go to work tomorrow at a hotel. No
hmm.
safety briefing yet. They didn't have the safety training yet. They were supposed to have a safety training, but that got called off. And now gets the call. You got to report tomorrow.
Hey,
I pray for these guys. They have no choice. Charlie, that's what upsets me. These employees have no choice. When your employer call, you got to go work, or you lose your unemployment.
yep.
And my heart goes out to these guys, because we all like see everything open up. Of course we do, but we want it to be done safely. And it starts with the arrivals. We want to make sure our arrivals are safe. We want to make sure the people coming off that plane are safe and not carrying the virus. Is that too much to ask? But again,
I would like to
what are we? Who are we? We're peons, Charles. We're peons.
I like to say first of all again, and I'll reiterate, I am so happy with our mayor on Kauai. Thank you very much. And I'll admit, not enough credit has been given to Dr. Berryman. She's pushing hard too. She's pushing really hard on Kauai, and I think she made it loud and clear that she would like more of the hotel workers to take advantage of the free search testing, so they can get a good handle. Gang, something to think about. Look at the island of Lanai. They were facing a huge outbreak. If we were to take a cut away in time and just look at what Lanai did, they located the outbreak on that island as an example, and they suffocated it to bring it under control, to bring it under control. And that's what we should be doing. That's how I know on Oahu, when they have those outbreaks, I don't think they're suffocating it. I think what they're doing is sitting back at the office and doing everything by telephone. These guys go out and they saturate that area to find out where the heck is that virus. Did it get beyond the borders of where they suspected? First suspected, okay? Did it get beyond the borders? So that's what makes it very, very dangerous. We got to go aggressively, and I hope they do it. Now, you know what's funny? You said it before. I wonder if people say watching our show. Well, gotta be right now. We're ready to get 150 people watching. But a good brother of yours on Maui, they got Onasa, your friend there.
Pono. Oh, yeah, Pono.
So anyway, he blew a gasket out of there, which is fine. I'm glad he did, because as a veteran, he said he let go another island work, but he couldn't go AAA to go get the test because AAA is not on the tested partners. And if you watch Hawaii News Now at 6, another veteran, they did the story, they ran them today. Another veteran that came from California to Hawaii to visit family and grandchildren had his test in hand, and they say, you're not on the trusted, and get these veterans labs nationwide. And I'm thinking to myself, today we celebrate Veterans Day, and yet you're telling us we not can trust the lab at the VA. Maybe it's because they're not in a money-making business like some of these other places. Maybe that's it. Who knows? Who knows?
Yeah, it's amazing how only certain labs, you have to have been approved by the lieutenant governor. I mean, really, come on, guys. We're trying to get people tested.
Yeah.
And tomorrow night we'll have the mayor and Dr. Behrman on. They will talk about their testing program that is going to be going on until the end of the year. It doesn't qualify for the trusted partner program, but it is available for people on Kauai that, and we really want to focus, and we'll talk about this tomorrow night. We want to focus on the hospitality industry, the hotel workers, airline workers, all of these people that come in contact with visitors, and try to get everybody tested. It's got to get it done. I mean, you don't want to be running around carrying this thing and not knowing. So we'll talk about that tomorrow. But it is available every Sunday until the rest of the year. I am concerned, and I made a prediction that by the end of this weekend we would be at 200 cases statewide, probably get up to 300 in the following week, and soon after that get up to 500 cases. And the way that's going to happen is if we don't have the adequate testing and we don't have adequate contact tracing, and then once we get to those numbers, it's going to be very hard to handle. So I hope I'm wrong. So we have Dr. Ignacio.
Ding.
Yep, she's in. Let me bring her in real quick. Siya po siya ka my house. Po siya eat bagong. There she is.
Yep.
She's not pulling a Donna Mercado Kim on us, huh?
No. There she is.
All right. Aloha, Doc. How are you?
I heard you.
Senator Donna Mercado Kim came on one night, and she had her picture, and I said, "What's up? What's wrong with the camera?" She never put makeup. She never get ready, so she just did not want to be seen.
I feel that, man.
But Filipinos no need makeup, so you guys all okay. No more excuse.
Yep.
Well, thank you, sir.
Yeah, like me and Charlie, it takes us about 45 minutes in makeup before we come on every single night, and it's tiring.
Yeah, that's stressful. It's stressful. You got the hair. You got to do the hair, groom everything.
Yeah, it's not easy. It's not easy. So
it's a lot of work. Appreciate it.
How are you? How are you, Doc? Welcome back to the show. I'm so happy that Dr. Kapono asked to have you on. I mean, we invite all. We hate bugging people to come on, and I know you guys are extremely busy, super busy. Everything going on with COVID and everything else. People got lives too. I mean, you got lives that you got to deal with. So, so we're so blessed and happy when we have an opportunity to bring someone like you on. So thank you, and happy Veterans Day. Are you a veteran?
Not me personally, but my dad was. And so we did a little bit of prayers, a little bit of memorial for him. But yes, for happy Veterans Day, and hope we're all thinking about our veterans. I'm going to mute myself sometimes because it's always when I start to do these things that my dogs, I have 3 dogs. The kids, they're fine, but the dogs decide to make a lot of noise when I'm on these things.
It's okay. It's okay. It's okay.
That's the beauty about this show. That's the wonderful thing about this show. Sometimes the dogs are quiet and a human is loud.
Now, where is practice for you, doctor?
I practice all over. I'm practicing, I'm a contractor, so I get to work all over the state.
Uh-huh.
A lot of time I spend on, I do work here in Maui, but I also go to Big Island a lot. I work on Kona side, I work on Hilo side. Occasionally I get over to Straub, but mostly neighbor islands.
Are you part of the HPH healthcare system, or or are you with multi systems like
I have
Kaiser?
my own little thing, my own little LLC, but I do work I do have a service agreement with HPH, and I do go over there sometimes.
Okay. And then we have Dr. Kapono right there.
Aloha.
Aloha. Aloha.
What's up, Doc? What's up, Doc? Thank you for joining us tonight. I see the head.
Happy Veterans Day. Happy Veterans Day, Mel. Uncle Charlie, I'm not sure if you're a veteran, but happy Veterans Day anyway.
Yeah, I was a veteran. Uh, a veteran dropout from school. That's about it.
Oh, thanks, Doc. Thank you very much. Thanks for joining us on. Lots to talk about. I know, and we wanted to cover. I saw your post today about the numbers. We've been talking about the last few nights pretty heavily about the reporting system, how we report, what are we reporting, the confusion it's creating around the state on all different islands, and we keep talking, and I hate to sound like a bragging guy, but Kauai, for some reason, and it's about the leadership, they chose to keep the community informed. They made a decision at some point a while back and said, hey, let's just share the information as we get it. Let's make it available to the community. So we do every day. Sometimes the press release comes out at 7 at night. Sometimes it comes out at 9 at night. Sometimes it comes out at 2 in the afternoon. Today it came out, I forgot what time it came out. It was in the early afternoon, but we had another case on Kauai, travel related. Passenger came in, returning resident, got the negative test, their pre-test, pre-72-hour test, came here, got informed that the person may have been exposed to COVID while they were on the mainland, took a second test, positive. One more added to our numbers. That makes, I think that's number 13 now. A couple of them got sick. They didn't take a second test. They got sick and then got admitted, got tested and were positive. My point is this, doctors, we are seeing, based on the reporting, we are seeing the brunt. I cannot imagine this is not happening on Oahu, on Maui, on Molokai, and Lanai, and the Big Island. And then the article today came out and basically said, hey, listen, we tested whatever it was, 18,000 or 15,000 people. We only came out with 18 positives. I cannot believe that, because we're seeing Kauai, who has a small percentage of the incoming travelers, are seeing the highest percentage of positives after being tested negative. So what's your take on that, Doc? I know I read your post. I'm like your cheerleader. I am.
Yeah,
I mean, it's reassuring when we see people in a capacity like you folks that actually are not afraid to speak.
Yeah, I got a call from a reporter today about that one, and you guys might have seen, I think there was another one on KHON2 that talked about this subject. To me, that's the same story that came out last week, and the numbers last week were 11,000 something, total, and I think it was 9 or 10 cases, and now it's 18, I believe, and 15,000 tests. And, I was quoted as calling it rubbish. I probably could have used a better word, but the word, I think the best word about that is misleading. And I am starting to think that someone is intentionally misleading, because this is the second time it's being put out into the public in this way, that essentially is kind of trying to say, hey, look, 1 in 1,000 is the real deal. So the important part for the public to understand is that the vast majority of those tests were done on Hawaii Island, Big Island testing on the day of arrival. So the first misleading thing is that as if this was part of some planned surveillance program. It was not. It was part of an attempt by the county mayors to try to get additional safety protocols, and it was, accepted at some point. I don't think any doctors, really thought that was a great idea to do it the way that they've done, doing an antigen test on arrival to try to, decrease risk. But it's even more concerning that then now those numbers from that testing are sort of being promoted to the public as representative of a very low risk of infectiousness amongst travelers. And that's the vast majority of those 15,000 tests, as far as I understand it. So the problem with that is that I'm told only people who did a pre-travel test were allowed to take that second test on Hawaii Island. So everybody that took that second test at most took another test and was negative 72 hours before, or, for the traveler, for the places where they offered the rapid molecular tests on the day of travel, it might have been the same day or very shortly before. So of course the numbers are going to be very low. We didn't wait even close to the incubation period or beyond that to try to get a sense of what those numbers are. So, when I see, any doctor, but I mean, like DeWolf Miller was in this article today, I think he would understand that that's a problem. That's not the way that the data should be used to say that that's what the infectious prevalence is of travelers arriving. So it's misleading. I don't know if it's deliberately misleading or not, but when I've seen it the second time, I think maybe it is, or there's someone that would like to get that information across, and it's concerning to me. So there are other better ways to try to do post-arrival surveillance to gauge the efficacy of the the pre-travel test. And, some of it I think is, a little bit more intelligent, is being done by Dr. Peng on Maui. I thought that some of the Maui numbers that were in the article from last week were actually from his study, but Dr. Ignacio explained to me they actually weren't. So to get to your point, Kauai, because we had essentially 0 cases, our data is showing a higher rate than what is being promoted using that, what I would say is misleading or junk data. I just recalculated it again. So within the past week, we have 9 cases per 5,800 arrivals on Kauai. So we're right around 1.5 per 1,000 is what we're detecting. And you have to remember that that's not, we can't be catching them all, and there are a lot of studies talking about, what is the true prevalence, the true infection prevalence compared to the case prevalence, which is what you catch on testing or symptom-based testing. So I think it's pretty easy to say that that's at least twice as much or something in that ballpark, because this isn't a mandatory test across the board. So Maui is finding, similar things that are higher than this 1 in 1,000. And I have to admit, I'm just really surprised that this data is being promoted to the public without any caveats, without any explanation about where that testing came from. And there is a surveillance testing plan that the Lieutenant Governor was planning, and that's going to be to test on day 4 after arrival. I've seen an email that was sent to a traveler promoting that program. I think that is a more reasonable post-surveillance testing strategy, but I thought that that's what they were pulling the numbers from, and it's not. So, I mean, that's really misleading. But even testing the second on day 4, that's on the early side of that incubation period. The viral load starts increasing around day 4. So the figures I've seen is that you're still missing 70% of the cases that might turn positive on 5, 6, 7, 8, 9, 10, days after arrival. So if your purpose is to determine how many infectious cases are getting into Hawaii, that doesn't seem that wise to me either. It might be smart from trying to decrease infectiousness, so catch the earliest cases so you can inform those people, hey, you're positive, don't expose our population. So for other purposes, that might be reasonable, but for a post-surveillance testing program, that really doesn't make sense either in my mind. And certainly the way that this 15,000 or 11,000 tests from Big Island are being used is completely, erroneous and completely underestimating the truth. I'm thinking, Dr. Ignacio, you could fill us in on Maui about what you guys are seeing over there, but both Kauai and Maui are seeing higher numbers than that.
Yes, I agree, Kapono. I try to interface with as many physicians as I can in our county, and we all are trying to keep up and stay connected and communicate with each other. And as you know, like a lot of this information, when we have positives, it is passed through the county to the state. But, from the testing centers here that we are communicating with, we're seeing higher numbers than what the state is reporting overall. And look, we know it's such a complicated analysis. And I think all of us are almost exhausted trying to process all the information, all the numbers that are coming at us. I know the community wants answers. They want to know. And while I'm so glad that the state wants to do some surveillance testing, it really needs to be much more coordinated, right? Because we're just seeing different approaches, the numbers coming from different places, they just don't match up. And what we're hoping for is a much more coordinated surveillance effort so that we can really get a good handle on some solid numbers. And right now, I still think that's kind of lacking.
You
Mel, I think you brought up a good point too. Sorry, and I mentioned this in the KHON2 part, is that if you're going to use trusted testing partners, what's their end of the bargain? If you're trusted, there are a couple of things that I would want to know. One is, report to Hawaii or someone in Hawaii, like the Department of Health, how many people tested positive who wanted to come here, and were eliminated from the traveler pool because of that. Because if you track that over time, you're going to start to understand when the risk is increasing. The other part is, if those cases test positive and they don't have the results before they come to Hawaii, or they aren't forthcoming about the result, it should be reported to the state of Hawaii, because that those people are traveling to Hawaii. So it becomes the Department of Health's problem here to try to catch those people. And that's where, last week, I think it was Friday, when I found out about that there had been 5 cases on Kauai that were in that pattern. And I think that was partly because of Dr. Berryman's insistence that these should not be, not that they're intentionally hidden, but we should be aware of them. We should be talking about them because they increase the risk of, our travel reopening plan. And since then, I've heard that the estimates for the state are somewhere at least 20 or 30 travelers have done that. And to the Lieutenant Governor's credit, I've heard him start talking about trying to remedy that situation and not allowing people to bypass quarantine with, results after arrival, that they need to have their results, before they come in to bypass quarantine. And if he's able to get that implemented, I applaud him for it. I think most people would say, yeah, that makes complete sense. That's the way it should be. It's probably the way it should have been from the start. But I understand that there are, there are problems from the federal administration about how much help are you going to get with some of these things. And I to end on to put a positive note on it, I'm hoping with the new administration, maybe they will be a little bit more open to putting some pressure on the airlines or whomever at the place of departure to actually verify negative test before people get on the plane. So I would love to see that change in a relatively near future.
Well, I hope, I hope that'll happen. I don't envision that happening. I think, that lobby is quite strong. And it's just, the lieutenant governor now is trying to say he wants to have anyone that doesn't have a result cannot come on the plane. You cannot come on a pending test. But we know already that you don't have to take a test, right? You don't have
Right.
to. You're still subject to quarantine, but you don't have to take a test. And that needs to be fixed. I mean, we need to have everyone take a test, do what New York is doing, and everyone takes a test and you quarantine. And that's the big thing. When you look at surveillance testing, which is what they're bragging about, that we're doing all this surveillance testing, we tested all these people. You're right that tests, they need to separate out that arrival test that the Big Island did. They need to remove that from the numbers, because that's not part of surveillance. That was a requirement. That wasn't the second test, the voluntary test. When we look at the response on Kauai of how many of our visitors and non-returning residents are volunteering to take a second test, it's very small. It's very, very small. So what is the real number out there? We don't know. And we know it's higher than what we have, obviously. And Kauai is seeing quite a bit. And then you have those, you talked about the 5 that came in. They come in, they find out they're positive after they get to Kauai. But they're not subject to quarantine. They're not subject to quarantine once they land, right? Well, they are, but how long does it take for them to get that result back? And that's the scary part. We're seeing too many people coming in with a negative test that are actually positive. And we see some good people that are taking the second test, but the majority of them, vast majority, are not. And that is what I think will create the spread in the next week or two, because we do have a lot of people running around with the virus. I don't know what your counts are. What's Maui like now? What are you guys' numbers today? I didn't even look.
Knock on wood, I didn't look for today, but in the last couple of days, we've actually been pretty low, like 0 to 3, 0 or 4, like here and there, some scattered. But Maui has, knock on wood, done pretty well. But you still have to wonder that there are patients that they're gonna, they are seeing what a lot of my contacts are seeing is a lot more symptomatic people coming forward who are here and tested negative, but then become symptomatic later and opt for that second test. So we actually are seeing a good response or a good volunteer of people to that second test, but it's not what we would hope. We want everybody to do a second test, right? We do these things here in Maui to try and get them to take that second test with the card and trying to make it more attractive for them to do it. But bottom line is when you make something optional, it's not as effective, right? So it's okay for now. We're still worried about all these gatherings and we're still worried about, the community. The good thing is that Maui is, offering that free testing for our community, and that's made things a little bit more palatable. When it comes to the visitor testing side, at least, I think that the community at least feels safer that they have access to some testing here and that they don't have to pay for that. But there's still like a lot of holes where people can, and loopholes and things that people can slip through with, so.
I wanted to ask all of you. It seems I come from the school of hard numbers. I don't care what, because I know I'm a doctor, but I know in law enforcement we cannot do. We look at surveillance, but we're constantly looking at a target that we're going after. We're not looking at, well, today there's 15 chicken fighters going in, so only going to get 15 guys that are going to participate in the derby. No, that's just 15 going in now. We're going to be counting everybody that goes in. And I guess the point I'm trying to get to is, if you do the surveillance testing, and correct me, either of you doctors, because I'm still trying to understand this. If you come out with a number, then you're basically basing it on that given moment in time, where it yielded that number, right? So 1 in 1,000. But what if it's actually you got 10 in 1,000 and we miss that? We're actually basing everything on that 1 in 1,000. So that's number one. That's what kind of makes me wonder. It's okay if we're just trying to put data together, but like it's a hit and miss type of thing. And I think when we're coming down to this, it you talked about, like now the lieutenant governor wants to do more testing on the back end. This is the kind of stuff, and even you talked about it before too, Capono. we give, and even the Maui group talked about it as well. This is what all the studies are showing us. Let's move towards that first. And if it's too much and we can't sustain it, we can always scale back. But to go the other way and do it, it's like, we're going to start over here, but then we're going to ramp them up later on. It didn't make sense. So now it almost seems that we're in that ramping up stage, And the thing is, how well will the state be able to ramp up is another question. So now you've got a lot of viewers that are watching, and we've always said this for the last couple of weeks now. These people have been on the journey with us for the last 8 months, and we all started off the same way. We all started off as low, but I think we're pretty smart now. And so when you got like what you said, Capono, about these numbers being duplicated, but just put in a different packaging and sent out for the people to look at, it's kind of like, hey, wait, we've seen those numbers before. Something's not making sense. When you start doing that, how do you get the people to buy into the program? Because what we're trying to do is have people to buy in at this point. And it's just like, because if I was a traveler coming from the mainland and I knew how strict you guys' rules were, I can tell you one thing right now. I'll take a pre-test to get in. I ain't taking a second test. Because basically you might throw me into a position that I don't want to be in. And I'm going to spend all that money. And the thing is, we got to do it in such a fashion. And I said, you're giving out programs to entice them, but make it a solid one that says, hey, we got to get you in this corner because why? You're coming from us. I would even go one step further and say, let us look at the states that are having massive outbreaks. Let's err more on the side of caution with them than someplace like Vermont that's relatively low. If they came from Vermont, hey, yeah, we can run a risk of letting it slide by. But you got these states now that are coming up in the thousands a day. I mean, do we want to take it lightly or do we want to take it really seriously? I think we got to start looking at that. So anyway, that's my 2 cents.
Using some common sense there. That's common sense, right? You want to just keep our defenses up first.
Yep.
And then let us see how everything plays out, and then lower them in tiers and stages, rather than defense is down. Let's just let everybody in, and then kind of catch up. Now I got to catch up instead of just keeping up the wall, keeping everybody safe until we know how things are going to play out. It seems like common sense, right?
Yep.
Well, I would say it does feel like we're getting into a battle for public opinion. And I have heard, sort of things stating no one is doing a second test. Like we would be the only people in the world that are thinking along that line or those lines. It's just completely not true. I mean, if you look up any data, from any experts or countries that took this seriously, places with tourism that didn't have much cases and reopened, they're all thinking along these lines. I mean, some places in the Caribbean, it's 3-4 tests, I mean, they're doing a whole lot more. So, you can just Google it. I mean, and you can see, I mean, they're really like, I think only Alaska, Tahiti and Hawaii have tried to do this, and we've seen what happened in those places. So I know it's kind of being promoted that we're like the weirdos and we're being like overly cautious, but in the circles we run, it doesn't seem like that to us. To us, it's like everybody's saying this, and our state leaders are saying this different thing. So it doesn't seem like that to us. I thought maybe I could show a slide. Because since the reopening, some of the people in our group have really sort of pushed to try to get a better understanding of how did some of the leaders come to this conclusion of 1 in 1,000. So if you don't mind, can I share my screen and show
Absolutely.
this? It's like a Venn diagram that I think helps to capture what's going on.
But while you're doing that, can I read you a real quick? Can I read you a real quick question from one of the viewers? Question for the doctor. I went to an oral surgeon yesterday. He flew in from Seattle. I was concerned and asked him if he had taken the test. He showed me his negative pre-travel test. Then he told me COVID was not real. It was political. I'm worried. Should I get tested? Just the first part of it. No, it's not, but she's concerned because the doctor had just come from Seattle. He was a replacement doctor, relief doctor.
Yeah.
And
so if this, I'm going to answer it from, if this was my patient, what would I tell them? You know, it's relatively unlikely that this guy exposed you, but it's reasonable to be tested. You do have an exposure risk. They probably did work on your face, even though, you know, he was probably wearing a mask, but you were close to him for longer than 10 to 15 minutes. The more interesting thing is when to do the test. And I would say probably it's useless right now. You probably want to wait 5, 6, 7 days or something like that, and then do your test. So that's how I would approach that situation.
Thank you, sir. Thank you very much. All right. We can
so
see
can
the
you guys,
slide.
Yeah. So this guy from UW, University of Washington, Carl Kayala, helped us with this, and he's a colleague of Dr. Schwartz, who has been on your show before. So the first part, if I move my arrow, can you guys see this on the on the screen?
Mm-hmm.
Okay. So the calculations, as I understand it, the calculations from the state were based on this case prevalence. So this is this green circle in the middle. Okay. And you guys, I remember, I think when I was on with Tommy Waters, you're asking about prevalence, you know, and I tried to explain somewhat, but now, you know, the complications, the complexity of prevalence has expanded in my mind. But case prevalence is what the state leaders have been using. And case prevalence is based on confirmed cases. So those are people that were tested and tested positive. Usually that means they were sick or they had symptoms, or maybe they were part of a contact tracing effort. So that would be the majority of the people inside this green circle, okay? So the way the state calculated the prevalence was to say the number of cases divided by the total state population. And the example they gave was California, October 5th, it was 1%. Okay, so that makes sense. I'm going to admit that for the group that I was working with, you know, we tended to just take the prevalence in California and say, all right, that's the prevalence amongst travelers. Okay, so what the state leaders did is said, look, the prevalence amongst travelers is going to be lower than that, because if they're sick or they have symptoms, they're either going to not want to travel, or they're going to get caught through fever screening and these other symptom screening things at the airport. So they're saying, you know, this whole part in green, they're not going to travel. Okay. So then they said that, okay, based on other data, they're saying 30% of all cases are asymptomatic. Now, the data I've seen is more like 40 to 45% of cases are asymptomatic. So they really said these are only asymptomatic or pre-symptomatic people. Those are the only people that will travel. So using that 30% as asymptomatic, they basically said that only 30% of this green circle, that's the only people that would travel. Yeah, in here. So the arrow that I have right here. The problem is that the true infection prevalence in a community is much larger than the case prevalence, because for all the cases that you detect through testing, they're going to be people that were mildly symptomatic or asymptomatic or don't have access to testing, and they're still infected. So the true infection prevalence is a much bigger circle, this whole big circle, and there have been studies to estimate how much bigger it is. And those estimates have been 2 to 20. I mean, it depends on the time, you know, what time, what place. but let's just say it's 2, just to make it easy. So that circle, is really of possible people that would travel is twice as big than the case prevalence. And the real people, the population that would travel, is really this entire white part. And it's the persistently asymptomatic people, they would get caught on the test, because they're infected, even though they're asymptomatic, they would be caught on the test. So this is not really who the travelers are that we're looking at. So rather than this little slice right here, this is really what we're trying to find out. And it's difficult to know how many of those people are out there. But that was a critical error in the calculations as far as, we understand that led to 1 in 1,000 as being the estimate. And you guys might recall, that the people, the models that I've seen are more like, we're saying it's more like 3 times as much as that. And that's because it's more really this white part here. So I know that's kind of like, I hope I didn't put everyone to sleep and not engage the audience. These are not easy things to wrap your mind around, even for doctors. But I thought that this picture kind of helps people to understand where it looks like that some of the leaders got their numbers from and why that is probably an underestimate. Well, I'm pretty confident it's an underestimate, more than probably.
Yeah, I think if you look at the statistics now that we've been in this program going on a month now, that I think it's pretty clear to see that it's much more than 1 in 1 per 1,000. And you could that chart makes it very clear of why it's more than 1 in 1,000. Thank you for the slide. I understand why now they went with that number, but I wish they would. It's so hard because you don't have the control of all the visitors to test them. You cannot go out there and test everybody that comes in after 5 or 6 days on the island, and that would give us a true prevalency rate, which we know is not going to happen. But with models like yours, you could come out with a more factual number based on the amount of travelers coming in and so forth.
Right, and the other part is Alaska has data. Their prevalence based on testing upon arrival without any pre-travel tests, like the way Hawaii is trying to promote it, they came up with 0.6%. So still much higher, but there are also some real world evidence-based things that support a lot of the modeling. Mel, you brought up another thing which is called selection bias, but if you make something voluntary, then you're only selecting the people that volunteer to do it. And on Kauai, that's 2% of the visitors, 20% of residents. So that demonstrates a selection bias from the start. Why would residents do it 10 times more than visitors? Well, they care about the community where they live. They're going to be here. Visitors, why would they not do it? They're on vacation. So they only, they have a few more days left. They don't want to ruin it with a positive test, so there's not much incentive to get it done. So the 2% that do it with visitors, they're probably either starting to get some symptoms and getting worried, or they're very cautious and very considerate. And, they're probably the people we want to hang out with, those 2%, but, it's only 2% that are going to do that. And so when you have such a big selection bias, because it's not mandatory, it's very difficult to look at any numbers based on that process and say, hey, look, that's the truth. That's really what we're going to be seeing amongst travelers.
You remember, Charlie, you remember in high school, you in Kamehameha, so it might be a little different, but you remember when you was in high school and they would come on the announcement and they would say, hey, there's going to be a lecture on physics after school for anyone.
I'm having trouble connecting to the internet. Take a look at the help section in your Alexa app.
Oh. I'm not going to say her name.
You see,
But
when you
remember
like,
that? And so you had an option to go listen to a physics guy talk about their college in the mainland after school, into your beach time, or you don't have to. Well, you know how many % of my friends went to that? Same thing. These guys not gonna give up their vacation time to go take a test, like Charlie said, that may end up putting them right in quarantine for the remainder of their stay.
There is several. To me, there right now there is several. I think with the overall program, there are several components in order for it to work. It all has to go together. One is the data you collect. Two, if a person is found to be asymptomatic, but they're at that threshold where the viral load for shedding is so great, okay? If they get caught through a test, I would expect not this volunteer, hey, go home and isolate. That to me, that just doesn't work. It's just like saying, hey, you've been found guilty, so we're not gonna put you in prison, but you go home and you under house arrest. And law enforcement will always tell you, what is the average criminal that's going to abide by house arrest? That's why they put on those ankle bracelets and whatnot, because they got to find a way to actually get them confined. You don't give them the leeway. And and that seems to be the biggest problem, that every single time we have a breakout on Oahu, nobody can actually say, this is what I've heard time and time again. It's community spread and it's small clusters. Well, where the hell is it? I said, first of all, we just had a plane with 200 people. They're saying that's safe. There's no social distancing on an airplane. You know what I mean? So, what is the true message that you're trying to give here? So when you do that, it's very easy for any of us to be a Monday night quarterback and say, hey, they had one cluster and, okay, where was it? I think the reason why they're not telling us is because, was there a true contact tracing program started? Was it so hard enough that they did it where they really, because if you looked at Lanai as a cutaway, what Lanai did, right? Lanai did it so well that they basically stamped out that infection because they controlled it. Because why? You took a cutaway in time and you showed an island. If you do it like Lanai, you can't beat this thing. But I don't think the places like Oahu, which seems to be the largest in the spreading category, they're not doing that. And that seems to be the problem. So the good thing about it, you're sharing the information that everybody needs to know, because you're right. And I also like to hear from Dr. Ignacio about, when Maui had the breakout at Maui Memorial, how did you folks jump on it? Because first it kind of went away, then it came back, then kind of went away. So the thing is it going to come back again? Because nobody knows if it actually got stamped out or not, right? It's still kind of like floating out there.
That you're talking about when Maui Hospital, right?
Right.
That
Yeah.
cluster there. And that was in some ways a big mess and a wake-up call to the county, right? Because the hospital where you're supposed to be pretty safe and everything, there was a lot of strife because the healthcare workers there were feeling very stressed about the availability of PPE at that time.
Mm-hmm.
They were being told inconsistently about what was acceptable. And so, in the initial time when they started getting the cases and all that, and everybody started to get more scared, and the healthcare workers are like, let us wear our PPE that we want, let us wear the protection we want, let us get tested like this, like the way we want. And they were able finally, as the numbers were getting worse, they were like, oh yeah, we've got to get this under control. And they did a lot more like large scale testing. They tested everybody in the hospital and everything. And they were able finally to get it under control. But like so many things that instruct us, we don't learn until we've got that reality kind of right in our face. And there were a significant amount of spread that probably could have gotten controlled faster, and with a little bit more education on everybody's part on what to do. So, these are hard lessons to learn. And I feel like the county the county understood and has stepped that all up. Now we're seeing that our PPE is at least in a better place, right? And our healthcare workers feel a degree much more safe in the hospitals, especially, but in our county overall. I think that, you know, when we talk about all this testing and we talk about the information that's out there, you guys mentioned that doctor who said, or, you know, the patient asked the question, well, my doctor says that's not even real and they just flew in from Seattle. And it just goes to show you, you know, there are bright folks out there with like the blinders on, right? That there's a lot of information bombarding us, but there are still people who are like this. And if anything, if the viewers are getting anything from our discussion here, you don't have to know all the numbers. You don't have to know all the statistics or the models or anything like that, but be vigilant and don't let your guard down. I know everybody's tired, but don't be like this, you know, be aware, because our leadership, we need to be watchdogs and we need to be careful about how these things are playing out, or else, you know, if we just all kind of relax, it's too soon, right? So I guess my answer to your question again about Maui is, you know, the clusters happen. They did happen. I hope that our county is more prepared now. I think that the hospital definitely is. They took a lot of good steps, but then things like this happen, and you know, like that, like Big Island. I was so worried when it happened in the veterans home, and that was such a tragic situation. I didn't even envision something like that happening. So again, I think a lot of times we're just relaxing. Everybody's exhausted, and everybody's just like this. It'll go away. We'll be fine.
Mm-hmm. You know, and Dr. Kapono, I'm going to ask you on, I guess, on two-edged, you know, they talk about a two-edged sword. It cuts going in and it'll cut when you pull it out. But I'm going to ask you the question anyway. You know, given what's transpiring now, and we see some of the changes that the lieutenant governor is taking, and you know, to his credit, I mean, I think he may have had a revelation that, hey, the path I was on before, it ain't working. So he's trying something different. Do you think he'll go all the way in trying to, you know, be spearheading this second testing? And because, you know, remember when they said before, you know, we got limited testing, right? Testing capabilities. Now look, Honolulu on testing lab. They you know, they are rolling testing lab, and they get tested out the yin yang. And you know, Mel and I kind of made fun. I said, gee, if we get one small little test kit and bury them and water them every day, probably we're gonna have plenty test kits popping up all over our yard. Because now every place get on test. What's your read on that with the LG?
I guess I'm going to still put that in the hope category. I haven't heard any hints to doing anything along those lines. Most of what I hear is still kind of the message that the pre-travel single test is adequate. And, you know, we've seen these numbers being promoted in the media. But I do see some shifting, you know, as far as the cases that I was talking about, as far as the pre-travel positive cases, and not, you know, trying to cater to those people and, you know, make special accommodations for that, rather, you know, holding the line. The other thing that I'm liking that I'm hearing is talking about a statewide mask mandate. And I think Ron Kochi is going to be an integral part to having that happen. So, you know, if they can make that happen, I applaud it. Once again, I kind of think, like, okay, how was this being promoted? We were telling the public that we are going to be saved from this risk by having extraordinarily high masking compliance rates, like 95%. You know, I mean, numbers like that. I'm still hearing that message, but if that's what you're relying on, you better make it clear. And, you know, like, to me, a mandate it should be in place if that's what you're going to be falling back on. So I think that's progress, you know, moving along those lines. It'll make it more clear for people. You know, the thing that irks me the most, though, is this sort of preconceived notion that keeps kind of putting out, or is put out, that it's not travel, it's resident behavior, you know, that is really the key. And, you know, Kauai certainly shows that that's not completely the case, you know. And, you know, personally for me, it's it's insulting, I guess. I mean, I just don't think that's fair to say those kind of things before it even happens. And it seems like there's an agenda to do that. And that's, to me, not serving the people of Hawaii to kind of take that stance. And I'm not trying to get a us versus them thing more than it has to be, but that just is not fair.
I'll stop you right there by saying, no, I agree with you. And I know you're trying to be very nice about it, but this is what I will say. If we don't get enough testing done and these travelers do come in, they'll probably deposit. It'll be picked up by local residents, and it'll spread that way. That's the only investigative leg that anybody will see, is that spread from the local community out. Nobody can say if it was deposited here. And that's been from day one. How the hell did that virus get onto our shores? It just didn't sprout up. We know it came from the outside. And so that's the thing that we kept on pushing. Remember, we kept on pushing. Even to the point now, they did it back on September 25th and 26th, I believe. Right, Mel? Where they erased those numbers. They said, oh, we miraculously investigated the case, brought it down from 4,000 now to about 1,700. And they did one more shift change again. Well, I'm not trying to look at fault, but I say, like a lot of people that's watching tonight, we get Brian Ingalls on, who's a numbers guy, right? He's looking at certain data. And when data just go, whoom, the thing just fly right out the window. How the hell can you start breaking down numbers? Because, we're trying to get into a place where we can all do our part. But man, if you don't equip us well enough, rubbish in, rubbish out, that's all going to happen. And we're going to be barking up the wrong tree.
Right, and you have to be realistic too. If the point, I've made this before, but I think it warrants repeating again. When you do a poor job at contact tracing, everything becomes community spread. So if you see what happened with Alaska, when their curve started going up, it all became community spread at a certain point because they couldn't trace anything to anything. So the better that you do, and it's easier to do it in a place like Kauai or Lanai, the better you do at it, the more clear it is about where these things really came from. But I think the realistic part is another thing. So 95% mask wearing. Okay. It's bothersome to me as well to keep on saying, to have people say, stop talking about testing. We don't want to talk about testing. Masking is all we should be talking about. And I'm not saying masking is not important, but it's kind of like saying, okay, this is really on all the residents. So even though I have all this power to try to influence this situation, we're going to put this on the residents. And I tried to think of other examples of other diseases and how we handle them. The first case or thing that I thought of was like hepatitis A. Okay, so we had a hepatitis A outbreak a few years back that was linked to raw scallops at Genki Sushi. There was a big multi-million dollar settlement for the 200, almost 300 cases that contracted the disease that way. Shut down Genki Sushi, they got fined and everything. But we did not keep and then say reopen Genki Sushi. And if we had a test of scallops that would identify, only 30% of them have hepatitis A, we wouldn't say keep Genki Sushi open and just tell the people, hey, you have a 30% chance of getting hepatitis A at Genki Sushi. Don't eat at Genki Sushi though. Like, do not eat at Genki Sushi. But we're gonna keep it open. But don't do it. If you do it, it's your fault. Like we told you. So I think that's the kind of thing that's just like, come on, you can't put it all on the people, because you have to be realistic. Another example, and Uncle Charlie, I wanted to ask you about this. I know we've had some conversations about diabetes and medication. And I'm curious, so like your doctor, does your doctor tell you anything about your diet that you should do to try to like improve your diabetes?
Yes, he does.
What kind of suggestions does he make, or he or she?
Well, first of all, it's just a weight, to lose a little bit more weight. That's been proven. my blood work, because when I had lost the weight, did a blood work, and because of all the meds that I take, it my A1C was down, was in good ranges, and he was happy. And then of course I went on this Snickers binge, and well, that went right out the window after that. So I already know one area. And I think a lot of it, to be honest, we talked about it, was he says, you can continue taking these wonder drugs, but you're a first-hand recipient knowing how much you're paying for them, because some of the medical plans will not cover, like Januvia as an example, right? You get, you know, I walk in, I says, okay, Mr. Yona, your 3 month supply is 300 something. I said, like, "Oh, okay. I said, do you have a placebo, like a sugar pill in one of those that maybe I can take for a little while? So, the reality hits on that end. So, if I want to get better at it, just gotta, you just got, and just some of the intake on the foods, certain foods, the intake.
Right. I mean, and we're not perfect, so, what I commonly bring up my patients, white rice. I'd imagine your doctor might have brought that up too. It's a common part of our diet, in addition to the Snickers that, you like to eat on the shows. I like my Snickers too, but the reality is there that your doctor doesn't go, that's on you, Charlie. We're not testing you anymore. We're not going to screen high-risk populations such as Pacific Islanders or non-obese Asians, based on the data that we have. We're just going to tell everyone, stop eating white rice, no more Snickers or candy, and our job is done here. Meanwhile, let's bring in some people with Snickers, and just, have them kind of be, having fun, and you stay home, you watch them from your window and watch them eating their Snickers, okay? But don't do it. Do not do it, so those are just the kind of things where it's like, I get it. It's important, but it's not the be all end all of everything. And when you have power to protect people in another way through things like testing or other preventive measures, you use it, so I wanted to point that out. And if you don't mind, can I share one more figure about masking on the share screen?
Yeah, go ahead.
Okay, share screen. Okay, so if you look on the dashboard right now for Hawaii, sorry, this I think you guys can read it, but it's a little pixelated. We're seeing on all the islands high 70s to 80% masking rate on the Kauai dashboard. So, and I've heard some criticism, oh, look how low Kauai is. Now, this is data from from countries about self-reported, when you leave the house, do you wear a mask? So this is self-reported, which means it's probably inflated. If you tell me, hey, how many nights a week do you floss your teeth? I'm going to say all of them, but the reality is like 4. So it's always kind of like less than what people report, or usually these things are. So look at these numbers. Okay, the U.S. average self-reported is 59%. So and I think we all know this as well from what we saw happen, but Hawaii's masking rates are generally better than the rest of the United States. So to think that we're going to be so good that we can absorb a high amount of travelers that probably are less used to masking than us, that's a stretch. And then to say that, oh, how do we get people to 95%? You look at this, and apparently the Philippines is the highest one, but they're at 92. So it looks like 95% mask compliance rates are suprahuman. Nobody can do that. So, you kind of, maybe you need robots or something to help get up to that number. But what I'm saying is it's an unrealistic expectation to say those kind of numbers and think that it can be done. And it certainly can't be done easily, and it can't be done just like that. So I think we need to be realistic about our impact with masking, but make all the efforts possible completely. I totally support, all the efforts to try to mask as much as possible, but don't overestimate what people are able to do.
Yeah, and Kapono, can you keep your picture up for just a second more?
Oh, yeah. Sorry. Let me see if I can get it back up. I'm screwing up right now. Okay, hang on.
Take your time. My
Yeah.
point is that, if you think about the correlation of, okay, what are COVID rates in these respective countries? Is there a correlation? I support masking. Of course I do. It is an inexpensive way to help control the spread of this disease, right? But the Philippines, we know that their COVID rates are super duper high. So even if they are wearing masks, they still have these other challenges in terms of physical distancing, right? And the fact is that there is still a lot of spread. Even here in Hawaii, we know that our Filipino communities and our Islander, Micronesian, Melanesian communities have greater impact of COVID. So, culturally speaking, that's great that you can get this mask compliance to some incredibly high levels, but it does not necessarily, as you know, correlate to complete protection, right? Thank you. Thanks for showing that. We can go back now.
Yeah. I have to admit, I thought Japan would be at the top. I was sort of surprised by these numbers. This is from the New York Times if people care to know the source, but it was surprising to me to see the numbers that are on there. And I do agree there's great evidence in the United States and other countries of when mandatory mask mandates happened and how it impacted COVID. So it's important, especially when you have smoldering community spread and things like that, kind of more like Oahu. But, Kauai, I'm not saying we have an excuse to not wear masks, but when we had zero, it wasn't masking that was, really the factor. For us, it's clearly travel.
I always said that they gotta do some education class, because like you said, the Philippines or even Japan that uses a lot of masks, but yet still their numbers are high. And I think a lot of it, we talk about the masking because it's now revealed that COVID is aerosolized. Okay, we get it. But then they don't talk about touching. I think half the time, I say it's more than half the time, people are touching surfaces without sanitizing before they touch their face to take their mask off, or they're rubbing it in their eyes, and they're getting it that way. Because if you got somebody who says, I religiously I used the mask, but you still get sick, then they have to get in from a different direction. You have to get into your mucous membranes or something. But we don't talk about it enough. Everybody thinks that, I got my mask on, nothing's gonna happen. But they don't talk about, and I put up the chart, I don't have it with me, but you look at the length of time that the virus can stay outside of the host carrier on top materials, 5 hours. Some is even days. I was shocked when I saw that, And if you don't take that thing seriously, you can get bit when you least expect it. I think that's what happens.
The frustration really, and you touched on it, Doc, is the fact that no matter what leader is on the mic, it's always put back on the resident. It's always blaming the residents, the fact that we're not masking, the gatherings, the funerals, all of these things that definitely contribute to the community spread. But they're not focusing on the root issue or the root problem, which is the visitor, which is the virus that comes in, gets passed on to a hotel worker or a cab driver or an Uber driver, and that person goes home. That person, by the time that ugly COVID head is reared, it's a week or more. Visitor is gone. Everything is, and then the only way you can trace that back is to community spread. Well, the guy had the mask. He wore a mask. Like Charlie's saying, there's so many ways now you can pick up this virus. I am just getting really freaking irritated with being spoken to like a kindergartner that am not following rules every single day, every single press conference. And yet we know what we're seeing here on Kauai anyway with the visitors and the amount of virus that is coming in, that I don't mind taking the blame for something I do wrong, but gentlemen, let's focus on the issue with the tourists too. So if you get a 20-minute press conference, you want to spend more time blaming the locals, fine, but take that 5 minutes and let us tell us the numbers. Tell us the numbers like Kauai is. How many Honolulu? How many actually came in on a negative test and tested positive? I want to know that. Maui, Big Island. I really want to know that. I don't see that in the reports. No one's making that press conferences or press releases out. And if they are, I haven't seen it. But we want to know the real numbers. It's so biased and slanted. It's obvious that what they're trying to do, but it doesn't matter to them. They continue to do it. They continue to do it, and that's the frustration. That is for me anyway. It just drives me nuts. Drives me nuts.
I think some of this are sort of like convenient loopholes, not like there was an intention to hide it, but also not a desire to share it either. I mean, when it's obviously an important thing. You know, I know your desire to get those numbers. Like I said, I heard 20 to 30, but Kauai really is only getting 10 to 15% of the tourism. So at 5 cases, you know, 5 known for Kauai, I would guess it would be more like 50 or something for the state. So, you know, I'm glad it's been exposed now, and I hope that there's a remedy for it. I think it's, you know, exposing an important part of even this single pre-travel plan that is not working the way that it should.
I just don't see the humility in some of these leaders to come out and admit it. I mean, you know, it's everybody. Everybody was sharing their knowledge. Doctors, you know, Charlie and I, we're just a mouthpiece. We're like the medium that the information gets passed through to the people. But all the experts made it very clear a long time ago that this would not be the appropriate way to do it. That we needed to be careful, and it was just a few, a couple people in the state that said, no, this is going to work. Trust us. It's going to be very hard for them now politically to come back and say, oops. I can see the gradual change. Yeah, we gotta focus hard. In fact, he even laid some blame on Caldwell, and the lieutenant governor did, and said, hey, I'd like to see Honolulu step up their voluntary second testing. Well, a month or so ago, he said we didn't need a second test. That the one pre-test 72 hours before departure was more than enough. Very few would come by. And we're finding out now that is not true. But I have not heard a peep from him to come up and say, the numbers are not what I expected. And we definitely need to make a change. What? I respect him for that. But I don't respect him for putting out crappy bullshit numbers and making the numbers fit your hypotheses, which is really what he's doing now. And I mean, I don't mean us against them. It has nothing to do with that, Doc. This is all about, this is real. This is true. This is happening. And if we don't get a handle on it and make the changes now, it's going to get worse. It's going to get worse. And God forbid, you know.
I think, unfortunately, the state of Hawaii might in part be sort of caught in a political game between people vying for governor in the future. And Tommy Waters kind of hinted at this. So I hope that that's not a prominent factor in decision making. But, like I said, I think it was the second time I came on here, when Sarah Park and the contact tracing situation, kind of was really blowing up. I think we should try to be forgiving. I mean, a lot of people have underestimated this virus. I think that they should not have. I think that a lot of them had the knowledge base not to do so. But I'm like you, you can just say you made a mistake. Or, for example, I did not think that there was going to be, we all sort of thought that April, May, June, okay, that's the surge in the United States. And then things will probably just kind of like smolder from here. Not that there's going to be another one in August and then another one in November, which kind of has just matched each time the state tried to open up. No one could have predicted that, accurately. You wouldn't have known that was going to happen. So I think there is some space to, give some of our leaders some leeway for underestimating what they were going to see, from the prevalent standpoint we were talking about. But there are a lot of either foolish or I guess, decisions influenced, I think, by other priorities that are harder to forgive. But when it comes down to it, to me, we can forgive. We can forgive right now. This is unprecedented times, and you can't just put everybody on the chopping block that made a mistake or fell short. So I have no problem with people saying, like that they underestimated it, as long as they start taking steps to correct it. But like you guys said, it really does bother me when I think half-truths or mistruths are being promoted to the public to try to support something that is not really justified, and also to put the blame on residents in an unfair or unfounded way.
Well, I'll tell you one thing. I'm a very forgiving person. Just not piss me off, especially when you tell me that I fear mongering, because that is what got under my skin. I said, "Oh, brother, we leaving the door wide open. So if you gotta retreat, it's okay. We understand. But it's all it's like small kid time. You backing up. You cowering out, but you say like, yeah, you're lucky I don't get you right now, and you backing up. You're moving away from the guy. You know what I mean? And that's what happened. I felt like he was retreating. He goes, yeah. You feel mongers. I go, hey, cool it already. Because you don't like me. You still within grabbing reach. You within grabbing distance. And I think in order for we to move forward, I firmly believe number one, first, the data comes out. It has to be as accurate as possible. Even though we don't know how they, we know certain numbers are used for certain things, but they gotta start getting back into informing. Okay, they seem to have completely cut that out. Before they would give us batch numbers of testing, how much testing that came from that batch, how much were positive. They don't even release that kind of information anymore. So when you look at the positivity rate, because a lot of the tier operations that Honolulu has, they go by that rate. Those poor people, they don't know whether they're coming or going. They just gotta take it for what it's worth. Like, oh, you guys yeah, you guys at 3, or you guys at 2, and you just gotta take it for what it's worth. And I think everybody deserves answers. You know, I mean that's
I
the
think the battle is really the integrity right now. I think the confidence. I think the people right now, and and maybe this show just educates more people about what's going on. But that's not the intent. The intent here is not to lay anybody's head on a chopping block. But yeah, I agree with you, Doc. I mean, I know I speak for most of our viewers. Some are beyond pissed off, and maybe there is no room for forgiveness. But I think for the vast majority, yeah. But you, when you I used to say this: if you're gonna lie, I used to tell cops when I was a cop and I was investigating or interrogating someone. I said, listen, pal, before we start, if you're gonna lie, I hope you get on good memory. I hope you get on good memory. And I'm not saying the lieutenant governor, anybody is lying, but the misleading is, once you start on that track, it's very hard unless you come up and you just say, you know, we underestimate. I think that to me would be the best way out, because it's true. I do not believe, I say tonight, I do not believe anybody did what they did maliciously. They were convinced to do it this way because it was for the betterment of the state. But early on, they should have seen the signs that said, and listened to the experts that told them, hey, this may not be in the best interest of the state. But they opted to continue because they didn't have the balls really to come up and say, hey, we got to change direction. And let's play this out and hope that it doesn't increase. Hope. Well, now they're in a bind. And I tell you, the best thing for them to do right now is to come up and just say, we got to change course. We got to change direction. If not, we're going to see some bad things. And I got to believe that majority of the people in this state would forgive them and would support them, would support them. I believe that. I think that's just what Hawaii is. I think that's what we do. I really do. But the longer they continue this, the harder it's going to be for get forgiveness. It's just that's how I see it. Anyway, it's like I ain't no psychologist, I'm no doctor, I ain't nothing, but I'm a realist, you know. I was an accountant. So I tell you right now, I used to pride myself because I changed my mind and apologized on the record for misspeaking more than any other politician in the country in my term on the council. Portuguese, we talk fast, yeah. Sometimes we talk before we think, and then the next meeting you realize, oops. Yeah, the first thing you do is you say, you know, I want to just apologize. I misspoke at the last meeting. I was corrected. It's not hard to do. You know, that's not hard to do actually. If make you feel better too after you do it. So anyway, I know we're way beyond the time, guys. I appreciate you guys so much. Dr. Ignacio, anything you want to say to our viewers? Your
Nothing.
dogs want to say anything to the viewers?
I think you guys, this has been a great conversation, and I'm so grateful that you guys continue to shine a spotlight on it, because we just have to keep, sending out that message. Everyone stay vigilant, pay attention, do your best, and we appreciate that you guys keep doing that every week. Thank you.
Dr. Kapono?
Since the reopening, I've been repeating our Hawaii motto to myself, and that's probably what I would say. It's just Kapono. So stick to what we're doing, take care of each other. Righteousness will prevail in the end for Hawaii.
Wow. Charles.
Well, I had it all planned, but he took the words right out of my mouth. So no, to our guests again, it is always a privilege to have individuals such as yourself, Dr. Ignacio and Kapono. Thank you so much. I mean, personally, the conversation, I get intrigued because there's always nuances to the information that comes out, and we look at it, and it kind of puts me in check too. So I just want to thank you both. To our viewers out there, again, it's always been our goal to inform and educate. You may have seen these individuals on before, but like myself, I hope that they brought additional information on, which I believe they did. And it gives you the opportunity to digest and see what direction we need to go. Because at the end of the day, if you personally feel out there that the state is not doing right, you are being armed with everything you can to protect yourself. And I think that's what we have to do. Because if the state falls short of its mark, we have the power to take care of ourselves. We distance ourselves, wear our mask, but also remember, you got to wash every single time you touch a surface. I mean, you got to do it religiously. I don't care what you do, because if as long as you put in that sanitizing process between each move that you do around your face, then you'll be protected. I believe that wholeheartedly. So thank you very much for joining us, Brother Mel.
Thank you, guys. Thank you all. It's always a pleasure, guys. I mean, our viewers, they wait for our show at night at 7 o'clock to be fed with information that is valuable and helpful. And you guys did that tonight. It's always an open invitation for both of you. You guys want to, if something comes up that you feel, I don't care if it's COVID related or whatever, you guys need a venue to get the word out. There's an open invitation to the both of you anytime you guys want to come on. Good discussion tonight. I think, it doesn't take away, and Charlie just said it, doesn't take away the importance of wearing your mask and social distancing and all of that stuff. We more than ever, now more than ever, we got to do that. You've got to be really conscious about doing that. And Charlie's right. The disinfecting before you touch your mask and after. Yeah, I mean, it just has to be done. This whole thing with the state and the reporting needs to be fixed. It has to be fixed. And I'm hoping that, the legislature supposedly is going back into session to discuss a mandatory mask bill. I would wish they would go into session to mandate accurate reporting by the Department of Health. I think that would be more helpful than anything else right now. I think we need to know. For your home budget, if you don't balance your checkbook, man, you're gonna be in trouble. And that's where we're at. Our numbers ain't jiving, and we need to get to that point where we can balance our COVID checkbook, and that needs to be done soon. So anyway, again, thank you so much, viewers. As always, you guys are a blessing. We love you guys. Tomorrow night we have Mayor Kawakami and Dr. Berman. They'll be on to talk about the testing and how we do on Kauai, how we take care of our numbers and how we report it out to the public. It's going to be a fabulous show. So join us tomorrow night.
And Mel, let them know too. Part of our goal tomorrow night, we hope you folks tune in, is to let your friends know that work in the tour and hotel industry, because a lot of it will be geared towards them, to get them to take advantage of the free search testing, because we really want to know if any of you are getting affected. It's really important. And that's part of the reason why we want Dr. Berman on too, so she can make that plea. Thank you, Mel.
Roger, thank you. All righty. If nothing else, guys, sleep well. Take care. God bless. We love you guys all. Aloha.
Thank you. Aloha.